And what's going on, guys? Alex here, and today I would like to give you a little bit of a live update and compare EMS and ICU, so essentially emergency medical services or ambulance and intensive care unit jobs. Let's begin. So, as far as you know, I am medical assistant right now, so essentially I am something similar to the nurse and a little bit lower than nurse, but still doing and performing the same things as a typical nurse does. And for quite some period of time I was working two full-time jobs. It was both Cardiac ICU and it was, of course, the second job, an emergency medical services or ambulance in Riga, Latvia. And for some period of time I was working for two full-time jobs. So essentially I was working full-time job, essentially medic EMS, and I was working full-time job also in the ICU, in the cardiac ICU. But starting from the June 2023, so starting from this June, I decided to quit one of the jobs, and I have quit the cardiac ICU despite all of the benefits the cardiac ICU has, such as much higher pay grade. It is 485 in the emergency medical services or ambulance per hour, and versus 650 for cardiac ICU. But still I decided to keep my EMS job, my EMS workplace, and I decided to quit my ICU job. So essentially, why did I decide to do that? So comparing these different workplaces, I decided to compare it in different types of points. First of all, it would be working conditions, then working specifics, and of course availability of sleep. If we're talking about working conditions, then in case of ICU, in cardiac ICU as well, we're talking about a specific workplace in hospital, and you do not depend on whether you have a standard amount of patients. The patients keep with you keep with the patients for as long as the shift goes in most cases, and it's pretty much standard and regular. Comparing that to the EMS work, when you have lots of patients, up to 20 patients per shift, and of course you depend on weather, because weather can influence both patients' behavior and your working conditions. And of course, let's not forget that you will be working not in a specific place, you will be working in different places, because as far as I have worked for all of this time, I have been starting from a landfill and cemetery and ending with the high top-notch apartments in the center of Riga. And talking about working specifics, if we're talking about working specifics in the cardiac ICU, in that cases we have patients with cardiac or blood vessels operations, the patients after these operations, and of course different types of patients with different worsening conditions. So essentially it's pretty much standard patients, and it is very little room for difference in patients. But if we're talking about EMS, then here we have everything starting from polytrauma, or essentially multiple trauma, and ending with the difficult and different heart conditions. So in the EMS you have much broader experience, and you have to differentiate between all of these conditions, compared to a typical ICU job where you do not have to differentiate anything at all, because as medical assistant all you need to do, you only need to perform what the doctor wants you to perform. Comparing that to the EMS job, where all you have to do, you have to differentiate the disease of the patient, differentiate the organ system of the patient, you have to provide the first-hand treatment, and if it's necessary, to transport the patient to the nearest hospital. So essentially EMS service and the EMS job is much more interesting, and it absorbs lots of conditions and lots of different diseases and disorders. And if we're talking about one of the most interesting, and that's availability of sleep, because both of these jobs, both of these workplaces and ICU, both have ICU and EMS, they have shifts, 24-hour shifts, so essentially we are working 24 hours per one shift. And the essential question which we have is how much time is dedicated towards sleep. So officially we do not have any time for sleep at all, but of course we have to sleep somehow during the night. So at least a couple hours of sleep, it's a need to, you need to have at least a couple hours of sleep in order to have at least half productive day the next day after the shift. So if we're talking about cardiac ICU, in that case we have had something around 4 hours of sleep, 3.5, 4 hours of sleep per one nurse, per one medical assistant. And so essentially the thing was that it was more or less standard hours of sleep. So when you're going to the shift, you are planning of something around 3.5 to 4 hours of sleep. Compare that to the EMS, so essentially ambulance, and compare that to schedule in the EMS, where you do not know how much hours of sleep will you be given during specific day, because it can be days when you will be sleeping the whole day and the whole night, and you will have only like 2 or 3 calls per shift, and you can have also days when you will have 18 or 20 calls per shift with almost close to none hours for sleep. But still, the main question is, why have I chosen emergency medical services compared to intensive care unit? First of all, and that's different medical cases, because if we're talking about cardiac ICU, in that case you will have mostly cardiac patients and blood vessel patients. Compare that to emergency medical services when you are working with different disorders, you are working with different disorders, with different systems, with different types of patients, with different classes of patients, and so essentially you have much broader experience. The next thing is colleagues, because the colleagues in the ICU, lots of them are awesome and lots of them are pretty bad. And compare that to emergency medical services, where the colleagues, so for you to understand, I have not met anyone, I haven't met no person who will drive me like completely mad. Like, everyone there are more or less adequate people, and you can work with them simply amazingly, and that's pretty easy for you to choose. And of course, if we're talking about colleagues, in the EMS I have not noticed any type of toxic relationships, any type of toxic vibes, toxic environment as a work environment. Compare that to the ICU, where you had toxic relationships with lots of nurses, with the head nurse, and where you were pretty stressed just coming to work. Compare that to the EMS, where you're coming to work and you know that the shift will be more or less okay, of course depending on the patients, on the cases you will have. Of course, one of the most important things, as for me, for now a medical student, and that's life or death situations, because of course ICU had theoretically lots of life or death situations, but these situations were planned. So if we know that the patient will die in a couple of hours, we know that beforehand and we can plan that, and so you know that it will happen. Compare that to the EMS, emergency medical services, when you go to the patient and when you do not know what will happen to this patient in the next 10 minutes. So essentially, the cardiac ICUs, the cardiac cases, the cases of cardiopulmonary resuscitation, it has much more experience in the EMS, in the emergency medical services. And talking about money question, the money question is also quite important for lots of people, but I decided to choose not money but my passion. So if we're talking about cardiac ICU, you can have much higher pay grade there, 6.5 euros per hour. That's quite a lot for a medical assistant, for a person without medical degree yet, and comparing to 4.85 euros per hour at the same EMS for doing on paper pretty similar job. So essentially I decided to follow my passion, to follow what I really enjoy, and that's I can say is one of the things which I would highly recommend you to do, because money is of course important question, but if we're talking about something you enjoy doing, so I suppose that this mental health issue is far more important for me, should be far more important for you, compare that to simply higher pay grade. And so by the end of the day, what matters most is what I really enjoy doing, and of course everything can change, because right now I'm a medical student and I do not know honestly where I will end in a couple of months. Maybe I will simply change everything I'm doing right now, but in any case it was my quite a small life update just for you to know. Thank you for watching and see you next time. Adios.